In this video, I want to talk about the roadmap for treating your keratoconus. If you're watching this video, you probably have a condition of the eye, which the eye becomes abnormally steep over time, which usually leads to poor vision problems such as glare, extreme blurred vision, halos on lights, etc. So where are you in your journey? Let's discuss it. So first of all, if you are a young patient and you've been recently diagnosed with keratoconus, one of the first steps you should do and pursue is how to stop it from getting worse. Because once keratoconus progresses, unfortunately, it is permanent. So it is extremely important to get ahead of the game and to stop it in its tracks. The best way we've learned, in fact, essentially the only thing we know currently to stop it from getting worse, is a procedure called corneal cross-linking. Corneal cross-linking involves you getting special eye drops in the eye at a surgeon's office and shining ultraviolet light on those on the eye after getting those eye drops to strengthen the bonds of the cornea, or to cross-link it. When we cross-link the cornea with this procedure involving riboflavin and ultraviolet light, it stops the eyes from getting worse. So that's the first step. Now luckily, if you're older, your eyes should stop getting worse naturally. But if you're young, you certainly want to pursue corneal cross-linking. After you discover that you have keratoconus and you've prevented it from getting worse, you should look into vision treatments afterwards. There are many different ways to treat your vision if you have keratoconus. If you have mild forms of keratoconus, a pair of glasses is good enough. If your keratoconus is beneath your visual axis, if you have a certain form of keratoconus where it doesn't intersect with your pupil, again, a pair of glasses can work just fine. If glasses aren't enough, and usually that's the case when you're watching this video, usually glasses were not enough for you, then a special pair of contact lenses is usually the next step. There are many different types of contact lenses. There are even soft contact lenses for patients who have keratoconus. There are small, rigid gas permeable contact lenses that fit over the cornea. Or there's also the larger lenses you've heard about perhaps, and this is currently the most popular way of treating vision, is a scleral contact lens. So these are the special lenses that you can use to treat your keratoconus. Afterwards, if that doesn't work out, or perhaps you couldn't handle wearing contact lenses or really didn't want to wear glasses, there are other surgical procedures you can pursue after those other non-surgical procedures fail. The first one is Intacs. It's not as common these days, but Intacs involves inserting pieces of plastic in the cornea to reshape the eye. By reshaping the eye, we can make the patient a better candidate for just wearing a simple pair of glasses. Or by doing the Intacs, we can reduce the overall prescription so that the need for glasses and contact lenses is much less. The next thing is PRK. PRK is done to reshape the eye so that it eliminates some of the vision problems associated with keratoconus. Know though that when you're doing PRK, there are certain drawbacks to doing it. First of all, it can thin the cornea a little bit more. So know that keratoconus happens when the cornea is too thin, leading to that bulging. So a procedure that leads to more corneal thinning, watch out. There are some risks involved with that, and make sure your surgeon is very confident that it won't lead to any worsening of your vision afterwards. After that, if you cannot improve your vision with glasses, contact lenses, Intacs, PRK, none of the above, and you've already done cross-linking and things are still not good, perhaps you've got scarring of your cornea, then a corneal transplant is your last resort. A corneal transplant involves replacing the cornea with donor tissue. It usually involves, right now, in removing the top part of the cornea and leaving the endothelium in place and then putting on the donor tissue. The reason why that's done now, instead of replacing the whole cornea, is that we found that when we just replace the top portion, there's less likelihood for graft rejection afterwards. So we'll take off the top layer of the cornea where the scarring was, or where the cornea was just way too steep, which we couldn't correct with contact lenses or glasses or other surgical procedures, and we'll just replace it with a new cornea. Usually after getting a corneal transplant though, patients are usually left with a lot of astigmatism, Their prescription is still highly nearsighted or farsighted, one or the other. And those patients still usually require special design contact lenses, glasses, or sometimes the surgeon can even touch up that corneal transplant itself with LASIK or PRK. So these are all the ways you can treat your keratoconus in the path you should be on. Again, if it's early, if you're young, you should cross-link your eyes and just get a simple pair of contact lenses or glasses. If it's getting severe where those cannot work, you can pursue other surgical options like Intacs or PRK. And lastly, if everything does not work, you cannot correct your vision whatsoever with any above, then it's time to just replace the cornea altogether with a corneal transplant.